The causative organism of Hansen's disease, Mycobacterium leprae, was first identified in 1873 by the Norwegian physician Gerhard Hansen, marking the first time a bacterium was linked to a chronic human disease. This landmark discovery shifted understanding of leprosy from a condition long attributed to heredity or moral failing to one with a defined infectious etiology. Hansen's disease, more commonly known as leprosy, continues to affect people worldwide today. Though often thought of as an illness of the past, around 200 new cases are still reported each year in the United States, reminding us that Hansen's disease remains a current public health concern. Mycobacterium leprae and Mycobacterium lepromatosis are obligate intracellular, acid-fast bacilli, which display a predilection for cooler regions of the body, including the skin, peripheral nerves, the eye, and upper respiratory mucosa. Clinically, Hansen's disease presents along a spectrum, determined largely by the host's immune response. At one end, the tuberculoid form is characterized by well-defined hypopigmented or erythematous patches with associated sensory loss and limited bacterial burden. At the other, the lepromatous form exhibits diffuse skin involvement, symmetric nerve impairment, and a high bacillary load. Intermediate or borderline forms represent varying immune responses and demonstrate a range of clinical presentations. In part one of this series, we will focus on the essential clinical features of Hansen's disease. Early recognition of the signs and symptoms is critical, as timely diagnosis can prevent complications and disability and improve patient outcomes. This short presentation will guide you through the key dermatologic and neurologic manifestations of the disease, offering practical insights to support accurate identification and appropriate referral for management. Examining the patient with a suspected case of Hansen's disease involves looking for the cardinal signs and symptoms of the disease, which may include the following: hypopigmented or reddish patches that are usually lighter or darker than the surrounding skin and may have well-defined or ill-defined borders depending on the type of disease. Some lesions appear dry, scaly, or slightly raised, while others may be shiny and smooth. A hallmark feature is sensory loss within the lesion. In more advanced cases, nodules, thickened dermal plaques, or diffuse infiltration of the skin may be seen, sometimes giving the skin a shiny or swollen look. The examiner should carefully assess the number, distribution, and characteristics of lesions, as these findings help distinguish between pausibacillary and multibacillary forms of leprosy. Enlargement of the peripheral nerves. Because of the predilection for the cooler and superficial parts of the body, a clinical examination should include palpation of the specific nerves known to be affected by the disease. In patients with leprosy, the hands, feet, and elbows should be carefully examined for loss of sensation and deformity, such as clawing, wounds, ulcers, calluses, or signs of repeated unnoticed trauma. Sensory loss and muscle weakness often prevent patients from recognizing and protecting these areas from injury. Loss of eyebrows and eyelashes, known as matarosis, is a characteristic feature of advanced leprosy. Loss of eyebrows and lashes is often the result of chronic inflammation and damage to hair follicles. Inflammatory changes in the eye. This can present as redness, dryness, or signs of chronic irritation. Careful inspection of the cornea is essential to identify early changes such as reduced corneal sensitivity, keratitis, or opacities. Assess for lagophthalmos, an inability to fully close the eyelids caused by facial nerve damage. Patients should also be asked about visual changes, tearing, or eye pain. Prompt identification of the cardinal signs of Hansen's disease reduces the chance of disability and long-term complications for the individual. Strengthening clinical awareness ensures that patients receive appropriate care, access to proper medications, and the support needed to achieve full recovery and maintain quality of life. The National Hansen's Disease Program, based in Baton Rouge, Louisiana, supports patients and healthcare providers across the country with 14 regional clinics throughout the continental United States and Puerto Rico. The program can provide free medication for anyone diagnosed with Hansen's disease and offers specialized services to help with diagnosis and treatment, including biopsy and PCR testing for tissue specimens. If you would like more information on Hansen's disease in our program, you can visit us at www.hrsa.gov/Hansen's-disease or call our toll-free number at 1-800-642-2477. Additional instructional videos about the evaluation and treatment of Hansen's disease can be found in the National Hansen's Disease Program Provider Toolkit located on HRSA Tube.